Welcome back to What to Be. We have Linan Schmidt, and she's a radiation therapist. Would you like to introduce yourself?
Yes, my name is Linan Schmidt. I have a Bachelor's of Science degree in radiation therapy.
Great.
Oh, and I guess I've been doing this for 20 years now.
Oh, wow.
That's a very long time.
So, I guess first of all, could you tell us a little bit about what exactly your job entails?
Okay, so my job is we can treat any type of cancer. So mainly right now we treat prostate cancer. So my job is to help the patients understand the daily procedure they're going to be going through, from what to expect every day coming in, getting set up for your treatment, doing imaging, side effects.
Sounds like a lot.
It is. It's just really important to let the patient know what's going on and making them feel at ease, because when you get a cancer diagnosis, it's difficult. So that's a big part, to help the patients feel at ease and help them kind of understand the whole process of having radiation therapy.
Sounds tough.
Yeah, it can be. So it just kind of depends on the patient. Some patients are, you have your stages of grieving, and some of them are still in denial. Some of them are still in anger. But you do have quite a few that are in the acceptance and just want to get going with treatment.
So it sounds like you need a lot of communication skills.
Yes.
Okay.
Definitely.
Yeah. So what other skills would you say that are necessary or would be good for the job?
Well, you have to be able to be efficient, and you have to, because we do have patients every 15 minutes.
Oh, wow.
So you have to be accurate when you're lining up a patient's anatomy, because you do want to treat the correct area. But you also have to be efficient, because you do have patients scheduled X amount, per minute. So that can be a little tricky, just depending on how anatomy is lining up that day, and if somebody's maybe having a bad day and you have to kind of get them through it, and just kind of depends on the day. But of course, communication, just being able to multitask too, is kind of a good thing.
Sounds busy.
Yeah, it is very busy. We're super busy right now.
So I'm curious about perhaps what education do you need to get into the field? Like, how many years?
Well, I have a 4-year degree. So, but I know, I can't remember exactly when, but before you could have just a regular X-ray degree, and you could have been grandfathered into radiation. But I believe nowadays you maybe you don't have to have a bachelor's degree. Not too sure. I know that all of us here have a bachelor's degree, and then of course Laurel has her master's. But yeah, I just think when you have that bachelor's degree, you've seen more, you've experienced more, you've done more clinical rotations. I think it just helps you overall when you're getting ready to get started in the field.
Oh, that's great. Yeah, and so it sounds like a long journey, as a lot of careers are in healthcare in general. So would you say it pays off and like on relative to how much you get paid now? Like, is it worth it?
I think so. It's funny that you say that, though, because when I chose this career, I had just gone to, you're just walking through the campus. Happened to happen upon Ronnie Lozano. He was in charge of the therapy program. And he was like, do you know anything about radiation therapy? And I was like, what is that? And so he just kind of explained it, and I was like, that sounds interesting. And it kind of went from there. But at the time, I had no idea what salary was. It was just one of those things. I was like, that sounds interesting. You're helping people. Technology is changing. And it was just one of those things I just kind of jumped into, because my first plan didn't really pan out for me, because I didn't want to leave the state. So it's just one of those things.
If you don't mind me asking, what did you originally plan on
Well,
pursuing?
I wanted to be a forensic pathologist.
Oh, that's interesting.
Yes, but at the time, the only body farm that the United States had was at the University of Tennessee.
Oh, okay.
And I was going to do like my undergrad at Texas State and then transfer, but then I was like, I can't leave Texas. So then the more I thought about it, and then once I learned about radiation therapy, I was like, oh, I can do that. That'll work.
Oh, well, I'm glad it worked out.
Yes, it did. Me too.
And so I'm curious. So for our podcast, we have a focus on women in STEM.
Okay.
So I know I've already interviewed Laurel, who is also a radiation therapist, but I kind of asked her more about management side. So for women in STEM, she mentioned in general, there's more girls than boys.
In therapy?
In therapy,
yes.
In general? Okay.
Yes. Which is interesting. I don't, because I don't know, maybe it's a compassion level, I'm not sure. But, it just women are more nurturing usually than men, I would say. But I really don't know why there's more women. Because we had, how many did we have? I think we had like 6 or 7 guys in our class. We talked about this the other day. For some reason, I thought there was less, and then we counted through. But yeah, since I've been out of school, I have only worked with one male therapist.
Oh wow!
So it's definitely skewed, but I don't know why though.
So, how does that kind of compare to, I guess, the representation of women in the STEM field in general, like therapists?
I don't really know. I just feel like, I think nowadays, girls are getting started younger, so then there will be more women. Yeah. But I feel like when we were there, it was definitely more men in STEM, just STEM-based things.
Yeah.
Why? I don't know. But I just feel like things are just different now.
That is true. Yeah. Things are changing.
Yes,
and I would love to see more women representation and stuff.
Yes, definitely.
Which is why I asked this question.
There you go.
Yeah. And so, do you have any general advice to give us for any high schoolers who are perhaps interested in going to therapy or radiation or both?
There you go. I think it is a very good career. You get to meet all kinds of different people. You get to share their experiences, and sometimes things are sad, but sometimes things are great, just depending on the outcome. You just get to learn a lot about people, and it helps you appreciate life and to know that there are some people that are at the end of their life, and but then there's some people that get a new lease on life when they are cured. So it makes you just appreciate things a lot more in life in general, and people and friends and everything like that.
Oh, yeah, that's sweet.
I'm a little more sentimental.
Well, I think that's great, especially if you're the one talking to patients and trying to get them comfortable.
Yes, it definitely helps.
So, I guess that makes it, I don't want to sound like callous or anything, but so I guess that means if you want to pursue this career, you kind of need to be emotional, but you also need to, I guess, keep yourself going no matter what.
Yes, because you're going to have those times where you're like, oh, this patient's in a bad way, but you have to keep going, and you have to get them through it. And, sometimes you do have to be a little more blunt with your words with some people, but you just kind of want to get them focused on the end. Like, let's keep going. Let's get this done. Let's finish your treatment. And,
so just keep going.
Yes.
That certainly sounds really tough, though.
It can be.
Yeah. Well, since I know that you're busy, so